everybody, how's it going? This is Andrea back again with another update for the NYHealthAct. Let's get straight into the update. For those who still don't know, the NYHealthAct is a state-level single-payer bill which would insure each and every resident New Yorker for every medically necessary procedure. That would include primary, specialized, vision, dental, mental, etc. Getting straight into the legislative update. Again, this week and next week it's always important to hit your senators, assembly members, and the beloved governor up through email, phone, or social media. But the next 2 weeks are particularly important because we are having a statewide day of action for the NYHealthAct on the 27th of January. We check, it is 27 on Wednesday. So make sure that you advocate your so that by come 27th of January we have as much public support needed to make this happen. We have waited patiently for 30 years. We are all patient, and it's time for this to happen so that people can go to the hospital in peace. So make sure that you are contacting your legislators and let them know that they need to co-sponsor the NYHealthAct. It is time. Okay, so for the policy update again, I will redirect you to my amazing friend Katie Season at @Brooklyn_grows, who has a Movement Mondays always up. So feel free to follow her on @Brooklyn_grows on IG and Twitter. And for my favorite part of the update, and I think I almost said the main community update right now, but anyways, if the community moves, the legislation moves much quicker. And that's a very important takeaway for today's national inauguration as well. We had an amazing we had an amazing moment where we saw the first South Asian / African American woman become the first VP. And that's the main takeaway from today's inauguration as well. We saw the first Black and South Asian woman become the VP. We saw Joe Biden take the presidency. It's important for us now to have them implement the policies that are going to save people's lives. It's that simple. If the community moves, legislation moves much quicker. So, again, getting straight into the main community update that I talked about before, we are having a statewide day of action for the NYHealthAct. I couldn't be more excited. I really couldn't, because this is us getting more closer to people getting to go to the hospital in peace, not having to worry about the bills. People have the right to live. People have the right to freaking live. So this is our chance. This is our chance to make sure that when we go to the hospital, our lives come first and nothing else. So yeah, you can hear it in my voice. For the editorial update, I'm going to leave the articles that I left last time. Make sure that you're tweeting. Make sure that you're making as much noise as a community member. You're talking to your friends and family and groups and congregations. You are rallying up support, and you are making sure that you're contacting your legislators. Also, make sure that you're contacting Senator Andrea Cousins and Senator and Assembly Member Heastie and ask them to make sure that they put the NYHealthAct on the legislative calendar. So the NYHealthAct needs to get on the legislative calendar. I'm so sorry I'm babbling. I really am. But this needs to happen, and I couldn't be more excited.